Welcome to Dr. Suruchi Puri's YouTube channel.
What do you mean by FST PRP?
So we are using a different protocol than the conventional PRP, whereby we are augmenting the platelets. We are concentrating the platelets to a sufficient level, which is highly concentrated platelet-rich plasma, and we are injecting it into the hair roots under local anesthesia after prior stimulation of the hair follicles with a particular wavelength of light to increase their blood supply and boosting or doing increased perfusion of the blood supply around the hair follicles with the help of certain hair boosters. So we want to really stimulate the hair follicle in the best possible way. So we are using a triad of all the hair stimulating combinations. So that is what I call it as the follicular stimulation therapy.
Is FST PRP safe?
Yeah, follicular stimulation method with the advanced PRP is completely safe. The only external agent being used is a very less quantity of local anesthesia, which is hardly 3 to 4 ml, and we do after doing a prior test batch.
How long does it take?
So it takes approximately 1 hour for the session to complete.
Do I need anesthesia?
Yeah, it's just local anesthesia, just a few points here and a few points at the back of the scalp, and you're good to go. You don't feel anything when we are injecting.
Do I need rest after the procedure?
You'll feel a little heaviness on the head as if you are wearing a helmet for 1 to 2 hours, except that you don't need to wash your head on the same day and don't do heavy exercise on the same day. Rest everything you can do, and nothing else. No antibiotics, no painkillers, nothing else.
How many sessions do I need?
Sessions required will vary from one person to another. In certain individuals, even one session can give miraculous results. It all depends upon how your follicles are and how good they respond to the treatment. However, some patients may require more number of sittings.
Is it permanent?
See, hair loss is a journey, right? So the DHT, which is being produced in males and females, it is a continuous, it's going on and on. You are trying to negate the effects of DHT on the hair follicles by using various medications, lotions, multivitamins, oral medications, and the procedure, which is this. So it's kind of a tug of war, and the better you make the follicles, जितना जल्दी आप उसको increase कर दोगे diameter को, जितनी early grade पे आप उसे start करोगे, the results will be long lasting.
How is it different from PRP?
So again, I just mentioned it's the volume, the concentration of the platelets and the boosters, which are going to make a lot of difference to the treatment. Unlike the conventional PRP, which most people are doing it with a standard kit, the concentration in those methods is very less and the volume is also very less, so we don't get the results which we desire.
How long have you been doing it?
So I did my research on pattern baldness in 2002 from the prestigious Maulana Azad Medical College, Delhi. So I have been doing hair treatments since 20 years now, more than 20 years. And when I started doing it in Delhi, PRP was not even being done anywhere else. And at that time, we tried all other commercially available kits and we tried to see what percentage of platelets are we producing, what is the concentration that we are getting with most of the kids. And after all those standardizations, we reached at a protocol which we are following now. So it has almost been 8 to 10 years that we are doing this protocol.
Is it a replacement for hair transplant?
Yes, in some cases it could be a replacement because you get such a good hair density, and if you maintain it with a proper protocol, you should be able to even minimize the need of hair transplant or delay it or even minus it completely.
Why do we call it follicular stimulation?
So as I just mentioned, since there are limited treatment options for male pattern baldness, and this is in all those years which I have worked with finasteride, minoxidil, microneedlings, derma rollers, all the alternative medications as well, I see and feel that this is one of the best reproducible results, most consistent results in almost 99.9% patients, which I feel if I select the patients properly. That's why it's always recommended to have a consultation with the doctor first, so that we can give you an idea of what is that you can expect from the treatment, and in the short term as well as in the long term.
Can we combine it with hair transplant?
Yes, you can do it before transplant, you can do it after transplant. Doing it before will minimize the needs of the graft. Doing it after will maintain the rest of the follicles so that you don't need a second hair transplant.
Will I get all my hair back?
That's not possible, because whatever grade of baldness you reach the doctor, some of the follicles have already gone. तो जो जड़ चली गई है वो वापस नहीं आती है. Just like जो पौधे के बीज खत्म हो गए हैं वो वापस नहीं आएंगे. That's why I always emphasize the need for an early treatment. Thank you.